Hey, if you have plantar fasciitis, you're gonna wanna listen to this. Most people who have plantar fasciitis struggle with for such a long time. They roll their foot on frozen water bottles, they use golf balls, lacrosse balls to try to free up and stretch out their foot. Some people even get needles stuck into the bottom of their foot or injections in their foot to try to just get rid of the pain. If that's you and you're dealing with plantar fasciitis, pay attention to this, but it will most likely have an easy solution. We just got to do the right thing. When people get plantar fasciitis, what's happening a lot of the time isn't some just problem with the bottom of the foot. They feel it on the bottom of the foot, but it's a reaction to something else that's going on. And something else is tightness and compression at the muscles at the back side of the leg on the calf. Listen, here's how it goes. When those muscles are here on the back side of the calf and they come down and they attach right here on the back of the heel bone. When those muscles get compressed and squeezed, it pulls on the heel bone, kind of like a puppet or Pinocchio. When those compress and squeeze, this tilts. And this little point right there, where the plantar fascia is right here, pushes down against the plantar fascia. That's why in the morning, it's really hard to walk, it's painful, and you get that pinpoint pain right at the base of your heel, here. It's squishing down against that plantar fascia like a needle or a nail that's pushing down through paper. People will foam roll and do all these different things and needles in to try to relieve it, but they're not actually dealing with the right issue. The right issue needs to be dealt with here in the muscles of the calf, as well as the joints in the foot. Look, there's tons of bones in the foot, and it's very easy for these joints to get restricted and locked up and not move correctly. And when they don't move correctly, that can stress out the plantar fascia as well as all these other muscles that are involved in keeping your foot function healthy and normal. So if you're dealing with plantar fasciitis, what needs to happen is that the stress needs to come off of these muscles. They need to be pliable and flexible again, and the joints in the foot need to be moving properly and optimally so that there isn't this interference with the movement of the foot as well as the tightness and restriction that's happening in the calf. So there's a couple different ways to do that. One, you can try to foam roll yourself kind of into oblivion by just rolling on the calf muscles and that kind of thing. But there's a better option. You can stop wasting time, wasting effort, wasting energy. And what we do here is we use a natural approach where we utilize hands-on treatment called active release technique to get these muscles to stretch and stay loose. The other part that we do is we adjust the bones in the foot. So we adjust this heel bone as well as many others that contribute to plantar fasciitis because of restriction in the motion in the foot. When that motion is restored over time, then the foot relaxes and calms down and that heel bone can move freely so it doesn't have to just press down against the plantar fascia again and again. We specialize in getting the muscles to loosen up and then to restore the normal motion in the joints so your body can function naturally and optimally. If that's you, head over to our website, lowcountrychiropractic.com, set up a time for a free consultation, and we're happy to help you.